My name is Cheryl Harris, and I live in Atlanta, Georgia. My senators are Saxby Chambliss and Johnny Isakson. My representative is the Honorable Tom Price. I thought I would share a letter that I wrote to President Obama last week, copies of which I hand-delivered to the local offices of my senator and representative. Dear Mr. President, your health care reform package needs to be passed by Congress now. I am a U.S. citizen and have been paying taxes since I was a teenager, beginning around 30 years ago. I continued paying U.S. taxes even when recently living and working in England for 3 years. I am now a U.S. citizen without health insurance. My late mother always told me to make sure I had health insurance because you just never knew when you might need it. So even when I was in school or unemployed, I made sure I had health insurance. I paid premiums, kept insurance going through COBRA, whatever it took. When I moved to England, London to be precise, I could not continue my Blue Cross Blue Shield of New York coverage, living in New York City at the time, but found that because I was employed as a lawyer and had a residence permit, I was eligible for health care in England through the NHS. I just registered with my local surgery and could see a GP for free whenever I was ill and also for preventative care. For a small premium, I also enrolled in the supplemental private health insurance plan offered by my employer there. Last year, the tax laws for non-citizens living in England long-term changed in ways that were to my detriment. So I quit my job and came back to the U.S. this past April. I've since been unemployed, but I'm actively looking for work. Because my employer was in England, there was no COBRA plan in which I could enroll. My finances are tight, but I budgeted what I thought would be enough to cover health insurance premiums. I applied to an insurance provider, Aetna, through my local bar association since group rates would be lower than individual ones. Aetna declined to cover me because of 2 pre-existing conditions. 1, a leaky heart valve, which is a birth defect, and 2, a shoulder injury I incurred during my move back and for which I was seeking and paying out-of-pocket chiropractic care. I appealed to them, noting that I was not receiving treatment for my heart condition and that it only required annual monitoring, and showing proof of my payment for the chiropractic treatment. They denied my appeal. I then applied for individual coverage to Blue Cross Blue Shield of Georgia, who had covered me back in the 1990s when I lived in Atlanta while attending law school. They also declined to provide me with coverage, citing the pre-existing condition of my shoulder injury. Blue Cross also denied my appeal, even when I provided them with full paperwork from the doctor, as required for the appeal, stating that my condition was a limited one and that treatment was finite. Because the insurance carriers who will take on my pre-existing conditions will either 1, require me to pay premiums I cannot afford, or 2, only give me limited coverage that does not extend to everyday health care, including preventative care, I find myself without health insurance. As a result, I am not signed up with a general practitioner or an OBGYN, as I should be as a female in her mid-40s. I am not getting the annual tests which I need, such as a mammogram or the echocardiogram and checkup with a cardiologist to make sure everything is still mild with my leaky valve. I am scared every day that something will happen, such as a car accident or illness, which will require urgent medical care, for which I will have to pay out of pocket. I am not on unemployment and do not qualify for public assistance. Such a situation, I fear, would bankrupt me. Also, I now need to find a job with a company that will provide health benefits, so that I will be brought under a company plan which should at least give me some, if not complete, coverage. I cannot just start up my own law practice, which I might otherwise do, since under our current system I will still be unable to obtain individual health insurance. There is something very wrong with the system where the end result is that the citizens of this country are able to obtain medical care in other countries without problem, but not in their own country. There is also something not right where our congressional representatives are willing to spend billions, if not trillions, in other countries, taking care of other countries' citizens, but not willing to spend that same sum or reallocate that very same money to fix something so very vital to the literal health of this country. I have copied and will hand deliver this letter to my 2 senators and congressmen. I am but one vote, one voice. But hopefully at some point something will register, and Congress will see that this reform package must happen now, before more citizens die or go bankrupt because the current healthcare system is so broken and inadequate. If nothing else, please make sure that a form of health reform passes that eradicates private health insurers from being able to deny coverage for pre-existing conditions and allow people to pay the same premiums as others without such conditions. There are quite a few of us willing to put money into the healthcare system, but we are being denied the opportunity to do so. Healthcare is not something that should be based solely on profit margins. Other countries see healthcare as a basic right of their citizens and make sure something is provided to all of them. How can the United States, a country for whom one of its founding documents is called the Bill of Rights, not be such a country? Just because our founding fathers did not foresee 233 years ago that there would be issues surrounding healthcare, and so did not include it specifically in that document, does not mean that healthcare is not an inalienable right of the citizens of the United States. I have a postscript after seeing tonight's town hall, where it appears that my congressman is one of many who are trying to make this an issue of infringing on state rights. Interestingly, they apparently have a solution, the House GOP solution, where they would pass legislation that encourages states to use new and existing programs to guarantee all Americans, regardless of pre-existing conditions or past illnesses, have access to affordable coverage. Well, what's the difference between having a public option via the federal government and basically ordering the states to have such insurance coverage as far as what is considered infringing on state rights? More so, most of the states are in deep financial trouble and are facing huge deficits and are trying to find ways to just be able to kind of keep going along. The state of Georgia is an example. How are they going to be able to fund these programs without raising taxes? It's either going to be somebody somewhere is going to have to pay more, whether it's at the state level or the federal level, or, why not take my tax dollars instead of sending them to Iraq and to pay for all the money that's going into Iraq. And I hate to say it specifically, but it's the truth. I would rather see that money allocated to be going towards something that really truly is going to the defense of the citizens of the United States. Because if we get sick and die and can't afford to have our health taken care of, what really is there then? Anyway, thank you.